If you were going to assess the quality of an infant-toddler program, what would be some of the indicators that would help you identify a high-quality center? As I was thinking about this, I made a list of a few important aspects. First, the care must be safe and healthy. This item is a showstopper. If a facility isn't safe for children, quality is clearly lacking. Now, let's admit, sometimes something may happen that briefly causes a situation that could risk the safety of a child. But in those cases, the staff are trained to keep a watchful eye and the situation is quickly remedied. An example would be if a plug protector falls out of the wall. Diligent staff notice that the protector is replaced. Another example would be crayons. When chunky crayons are purchased, caregivers note that they don't fit into a choke tube tester. However, what about once the crayon breaks? If it fits into a choke tube tester, it needs to be removed. Second, there must be positive relationships between caregivers and children. In all early childhood programs, and especially in infant-toddler programs, where the children are so dependent on the caregivers, there must be loving, nurturing relationships that are maintained. One way these relationships form and continue is through primary caregiving, where a large group of toddlers, for instance, are divided into primary responsibility of a few caregivers rather than lumped into a group. This doesn't mean that you ignore the children that aren't in your group. It just means you are primarily responsible for a particular group and work to ensure they are getting the best possible care. You would work to build strong bonds with their families as well. Third, caregivers must use developmentally appropriate practices. This is so important. Developmentally appropriate practices are practices that meet the needs of individual children based on their developmental needs as well as keeping in mind culturally appropriate practices. Fourth, group size matters. Group size is very important when looking at quality. Why? Because when children are lumped into huge groups, the quality of care nosedives. Smaller, more intimate groups are more conducive to building bonds between caregivers and children, as well as between children themselves. Fifth, ongoing professional development for caregivers is essential. Education is important. Not only is it important that the caregivers have what we refer to as pre-service training, but it is also important that they participate in ongoing professional development. Even the ideas in a training, if they aren't new, let's face it, we can all use a little refresher once in a while. Additionally, some ideas are new, and sometimes we need a new way of looking at the way we provide care. These are just some of the indicators of high-quality infant and toddler care. I'm sure you can think of even more.